undermined area of the flap. So you can see this was a relatively aggressive lift. We're out here to the lateral canthus, and the reason we're going to do this is because we're going to use different laser settings when we are over the undermined skin. So that's the first step, and we'll do that bilaterally, and this will give us our area here where we're going to turn the density down but use the same now fluid. We're going to put some laser corneal shields in. This is 2% xylocaine, 1 to 100,000 epinephrine. You really don't have to use a dedicated ophthalmic anesthetic. And put these in bilaterally. We've actually already put that in earlier. We're just putting it in again for demonstration purposes. All right, very good. Laser resurfacing settings. And my recommendation would be that no one should really laser a facelift simultaneously unless you have a lot of laser experience and a lot of facelift experience, because there are a lot of fine points that have to be taken into consideration, and you don't want to have these complications. We're going to laser the central oval of the face quite aggressively. This lady has a lot of actinic damage, so we're probably going to use this is the Luminous Encore CO2 Ultra Pulse laser. We're using the fully ablative mode, and we're going to do a pretty aggressive treatment here, 100 millijoules in a density of 6. So we're going to start by just going right up the midline. We frequently will have our anesthesia personnel go to room air instead of oxygen at this point. We have tattooed eyebrows here, so we have to be a little careful. So you get the idea. Now we're going to turn the camera off and catch up on the other side, and then we'll come back when we laser the flaps. 2nd laser pass. When laser resurfacing first began, people felt that you had to wipe the char off before doing a 2nd pass. Otherwise it would form a heat sink. But I did the first human study on this with histology, published this a couple of years ago in the Journal of Dermatologic Surgery, where we did split face studies, debriding on one side and not the other. And actually that's not true about having a higher energy. You actually have a little bit lower energy. So we do not debride between passes. Passes at 106, which is very aggressive. It's as high as this laser will go. The eyelid skin is thinner, so we're going to do a single pass here of 80 and 6. I'm going to do the same thing on this lower lid. Now we're going to change our settings and come back. One aggressive pass at 80 millijoules and a density of 6. Now we're going to do a second pass at 70 and 5. Now we're going to drop to 60 and 5. And we're going to do a single pass on the upper lid. And I'm not really worried about, we're not trying to address wrinkles here so much as just to blend everything in. So our central oval of the face, which has not been undermined, is lasered in the traditional fashion. And again, this is old school, fully ablative, take 2 weeks to heal, get a great result, CO2 laser resurfacing. And now we're going to drop to 80 and 4, and we're going to treat the undermined skin. So we're going to keep our fluence where it is, but we're going to change our density to 4. And you can see that we're careful not to overlap here. So this is a lower density, the same power, and we'll do the same thing on the other side, and then we'll come back and talk again in a second. So there we go. There is our 2 very aggressive passes of resurfacing on the central oval, and then our lighter pass, less density. Now what we're going to do is we do open wound care here, so we're just basically going to use Vaseline or one of the available commercial wound care kits, but I think Vaseline works great here. We'll do that for the first week. She'll wash with Cetaphil moisturizer twice a day, and then we'll switch, wash with Cetaphil cleanser twice a day, and then we'll switch to a moisturizer the second week, and hopefully she'll be back in makeup here in about 10 or 12 days. Since we don't debride between passes with the gauze like we used to, things heal quicker. You know, we used to debride each time we did a pass. And the problem is you do laser, which is very controlled, and then you're dermabrading that skin with a wet gauze. So that really increases the pain and the erythema. And I think one of the tricks to managing laser resurfacing patients is to make the procedure as easy for them as you can. And that's the point of another lecture. So thank you for joining us. This is Dr. Joe Nyamtu, LoveThatFace.com. Performing this video for Cosmetic Surgery Times magazine. Thank you.